Auzubillahiminash-shaytanir-rajim. Bismillahir-rahmanir-rahim. Today we discuss the anatomy of thyroid gland. What is the thyroid gland anatomy? This is our topic. We know that there are two lobes of thyroid gland, that is the right lobe of thyroid gland and left lobe of thyroid gland, which is connected with each other by isthmus of thyroid gland. These two lobes are also called as a lateral lobe of thyroid gland, which is connected by isthmus. In this diagram, we shows the associated cartilages of trachea and larynx. There is a thyroid gland on which there is a oblique line. We all know that there is very important line, oblique line, which is present on the thyroid cartilage of larynx. Here a oblique line is present on the on below the oblique line. This gland is started and up to the tracheal rings. So this is all occurrence of anatomy. We see that there is a cervical vertebra 7. We take the section from vertebra 7, cross section from vertebra 7. We got skin, platysma, uh, superficial layer of deep cervical fascia, which is also called as a investing layer of deep cervical fascia, which encloses the muscles. And there are a infrahyoid fascia, which encloses the infrahyoid strap muscles. There are a four infrahyoid strap muscles. Then we have in blue color, we have a pretracheal fascia. Pretracheal fascia basically connect the thyroid gland with the trachea and larynx. Now we take a section at C6 level. There is no such difference at the level of C6. We see that there is a esophagus, trachea, thyroid gland, and pretracheal fascia and infrahyoid strap muscles. Infrahyoid strap muscles are sternothyroid, omohyoid, and sternohyoid muscles. There is only one muscle which is not in relation with this thyroid gland, infrahyoid muscle, which is that which started from the oblique line of thyroid cartilage and inserted on the hyoid bone. That is called as a thyrohyoid muscle. This muscle is not included, while all the other muscles are infrahyoid muscles are included. It is a vascular organ surrounded by a sheet derived from pretracheal layer of deep cervical fascia. The sheet attached the gland to the larynx and trachea. We know that above is the larynx, and below is the trachea. The layer of deep cervical fascia covers the front and the side of trachea. Thus, it is known as pretracheal. We know that whatever we use the pre is mean before it's mean that in front of trachea, the fascia in front of trachea, it splits to enclose the you see that there is a pretracheal fascia. Here we see that it's split into the two parts and encloses thyroid gland. It encloses the thyroid gland, creating its capsule, and it is connected to the oblique line of thyroid gland. Once again, we use the oblique line of thyroid gland. It is connected with the oblique line of thyroid gland, and this is your thyroid cartilage. This is your thyroid cartilage of larynx, and to the arch of cricoid cartilage interiorly. Arch of anterior cartilage interiorly. A fiber group termed as a ligament of Berry is originated from this fascia and attaches the capsule of lateral lobe of thyroid gland to the cricoid cartilage of larynx. We know that these two cartilages are main cartilages of larynx. Now, now we see that here you identify the shape of thyroid gland, thyroid lobe, even the lateral lobe, right and the left lobe. It looks like a pear. It's pear shaped. Now we see that it extend from the thyroid gland extend from the C5 to T1 level. T1 level. So it is posterior extension from the C5, C6, C7 and T1. Then we have interior extension. Interior extension, we know that there is a trachea and there is a thyroid gland. Above is the thyroid cartilage. On the thyroid cartilage, there is a oblique line. Interiorly, thyroid gland is extended from the oblique line of thyroid cartilage of larynx below to the fourth or fifth tracheal ring, and posteriorly it extends from the vertebral level C5 to T1. We already discussed it. Then we have another OSPI type diagram. This one is called as hyoid bone. Below the hyoid bone, we got a important structure. This is called as a thyroid cartilage of larynx. Below the thyroid cartilage of larynx is the cricoid cartilage of larynx, and there is a below the cricoid cartilage, we know that there is a tracheal ring. There is a first tracheal ring, and this is the lateral or left lobe of thyroid gland, and between the lobes of thyroid gland is a isthmus of thyroid gland, and below is the fifth tracheal ring. On the other end, we show the posterior extension, which include it extended from the C5, C6, C7, and T1. What we new found in this diagram is these two structure. One is here and second one is here. One is called as a pyramidal lobe. Pyramidal lobe is also sometimes also present along with the thyroid gland. You can easily identify where it located. You see that this is the midline. This is the midline. And you see that this on the left side of midline, this lobe is present on the left side, and from this pyramidal lobe there is a muscular extension upward which attaches this lobe to the hyoid bone. You see that this is called as a levator glanduli thyroidi. You see the a pyramidal lobe is often present and sometimes it may be absent, and it projects upward from the isthmus. You know that below there is a isthmus, and usually to the left of the midline. We already discussed. A fibrous or muscular band frequently connect the pyramidal lobe to the hyoid bone. Above is the hyoid bone. If it is muscular, it is referred to as a levator glanduli thyroidi. This diagram is actually show the structure on the interior aspect of thyroid gland. We take a section at the level of cervical C7. Now we know that first of all we found the skin. If we are doing a dissection at the level of C7 level, then we found a skin. After the skin, there is a thin sheet of muscle which is called as a platysma muscle. Platysma muscle which is present in the neck. And this red color fascia, this is called as the superficial layer of deep cervical fascia, which is also called as a investing layer of deep cervical fascia. Then we found a fascia which encloses a infrahyoid muscle in right here, right here. You see that these are in these. This is the fascia enclosing a infrahyoid muscles. This fascia is called as a infrahyoid fascia. And the muscle which are encloses, there are in this diagram we can easily identify the infrahyoid muscles. Three muscles are present at C7 level. One muscle is above the thyroid oblique line of thyroid cartilage. That is the thyroid muscle. All the other three is present in this diagram. First of all, we found a sternohyoid muscle, then then there is a trachea, and there is a thyroid muscle, sternohyoid muscle, sternothyroid muscle, and this is called as thyroid gland. We have two muscles on this side. This is omohyoid muscle, and this is omo means shoulder. This omo means shoulder, and this is called as a sternocleidomastoid muscle, especially interior border of sternocleidomastoid muscle. We know that there is a two borders. This is like sternocleidomastoid. This is the interior border, and this is the posterior border of sternocleidomastoid muscle. Now we see that interiorly there are a three muscles, infrahyoid muscle, and the other is interior border of sternocleidomastoid muscle. Which are these muscle? That is the sternohyoid muscle, sternothyroid muscle, omohyoid muscle, and sternocleidomastoid muscle, that is the interior border of sternocleidomastoid muscle. If we are going to inshallah, in future lecture, we will discuss the infrahyoid muscle in detail. This diagram is also shown the interior relationship of thyroid gland. You can easily identify the muscle in front of the thyroid gland. This is the thyroid gland. This muscle is called as a this muscle is called as a sternohyoid muscle. This originates from the sternum and goes to the hyoid bone. This is called as a sternohyoid muscle. A muscle comes from the hyoid bone and inserted on the shoulder bone. This is called as a omohyoid muscle. And then there is another muscle which originates from the sternum to the thyroid cartilage, that is called as a sternothyroid muscle. Sternothyroid muscle, sternohyoid muscle, and there is a omohyoid muscle. And then there is a interior border of sternocleidomastoid muscle which is present here, and posterior border is present here. Posterior border of sternocleidomastoid muscle is present here. Okay, now we see the relationship, posterior lateral relationship of this thyroid gland. There is a carotid sheet on, this is the thyroid gland. This all is the thyroid gland, and we will look into the posterior lateral relationship. Okay, this is the thyroid gland. You found in green color is the carotid sheet. If I said carotid sheet, you will recognize the three content present in the carotid sheet. Number one is the common carotid artery. Number two is the internal jugular vein. Number three is the vagus nerve. These three are the contents of carotid sheet. Number one, common carotid artery. Number 2, internal jugular vein. And number 3, vagus nerve. These are the content present on the posterior lateral aspect of thyroid gland. These important structures: carotid sheet with the common carotid artery, internal jugular vein, and vagus nerve. There is one artery, one vein, and one nerve. One important nerve is present in this sheet, and this is located on the posterior lateral aspect of thyroid gland. Now we will discuss what is present on the medial aspect of thyroid gland. If you see the medial aspect, we go on the back side. Medial side, this is the midline. This is the midline. On the medial side, this is the medial side. This is the medial side. What you see on the medial side? We see on the medial side there is a trachea. Above the trachea there is larynx, and we found a esophagus. Esophagus, above the esophagus we know that there is a pharynx or nasopharynx. On the medial aspect, there is a nerve which is called as a recurrent laryngeal nerve, and recurrent laryngeal nerve is present between the trachea and esophagus. Groove between the trachea and esophagus. Now you see that on the lateral, on the medial aspect, there is a larynx. There is larynx. Then it explains what cartilages of larynx is present. There is a thyroid cartilage and there is a cricoid cartilage. And there is a membrane between the thyroid cartilage and cricoid cartilage, which is called as a cricothyroid membrane. And there is a pharynx, and there is a external laryngeal nerve. Which is, where is the external laryngeal nerve? External laryngeal nerve, which is the branch of superior laryngeal nerve. Basically, superior laryngeal nerve gives two branches. Number one is internal laryngeal nerve, which pierces the thyroid membrane along with a superior laryngeal artery. We know that we already discussed in the uh, in the lecture of muscles of pharynx. Now there is a two branches of superior laryngeal nerve: internal laryngeal nerve and external laryngeal nerve. External laryngeal nerve in the lower part, in the lower part of in the lower part of thyroid gland, what we found, there is a below the larynx there is a trachea. Below the pharynx, that is the nasopharynx, below the laryngopharynx, we found a esophagus. And there is, in between the trachea and esophagus, there is a groove in which a very important nerve is found, called as recurrent laryngeal nerve. Recurrent laryngeal nerve. This diagram again shows you a structure present on the medial aspect of thyroid gland, which are already discussed. And you can find what structure is present on the posterior aspect of thyroid gland. If we remove the thyroid gland, we found this green color anastomosis, as well as we found a, if we found on the posterior aspect, we found a this gland, this four glands, two on one side and two on the other side of each lobe of thyroid gland. These are called as parathyroid glands. Superior and inferior parathyroid gland and anastomosis between the superior and inferior thyroid artery. We know that superior thyroid artery and inferior thyroid artery anastomosis here on the posterior substance of thyroid gland. In this diagram is taken from the Atlas of Anatomy, and you can easily identify the parathyroid gland and thyroid gland on the posterior surface of on the posterior surface aspect of the thyroid gland. We found number one, thyroid gland, parathyroid gland, inferior thyroid artery, and superior thyroid artery anastomosis. we can easily identify here the structure present on the blood supply. Now we discuss the blood supply of uh, thyroid gland, which is external carotid artery. You can see and identify the external carotid artery. External carotid artery is present here. It gives a branch downward, which goes downward. This is called as a superior thyroid artery, which goes on the upper lobe and supplies the thyroid gland, which goes on the upper lobe. And from the lower lobe, there is a inferior thyroid artery, which comes from the thyrocervical trunk. We can easily identify the blood supply. In this diagram, very simple diagram, you can see the blood supply of thyroid gland. Arteries to the thyroid gland are the superior thyroid artery, which is the branch of external carotid artery. You can see the inferior thyroid artery, which is the branch of the thyrocervical trunk. You see there is a thyroid emma. Sometimes thyroid emma supplies, which comes from aorta, which comes mostly from the aorta. Okay? The arteries anastomose profusely with one another over the surface of gland, over the surface of this gland. Now we see that this external carotid artery and there is a superior laryngeal nerve. The relationship of, we will take the zoom. Okay, the inferior thyroid artery, a branch of thyrocervical trunk, ascend behind the gland to the level of cricoid cartilage. It then turns medially and downward to reach the posterior border of gland. The recurrent laryngeal nerve crosses either in front of or behind the artery, sometimes in front or behind the artery, or it may passes between its branches. Let's see, this is the recurrent laryngeal nerve. Here we have a thyrocervical trunk, and there is a branch of the thyrocervical trunk that is called as a inferior thyroid artery. Now, nerve supply of thyroid gland. You can easily identify in green color there is a superior cervical sympathetic ganglia and cervical ganglia middle cervical ganglia, and there is a inferior cervical sympathetic ganglia which supplies the thyroid gland. Thank you so much, and inshallah, soon we will discuss the infrahyoid muscles as well as the larynx. Wa akhiru dawana alhamdulillah.